Hey, Miss Smith, my name's Tom. I'm your nurse, and I'm just going to take a look at your heart, look and listen, okay? And during the assessment, I may need, we're going to probably have to open up your gown. I'll have to expose your chest, okay? So I just want to let you know. And what I'm going to do is I'm going to start by checking out your veins and vessels in your neck, okay? So the first thing I'd like to do is have you just turn your head slightly to the left there, and I'm just going to look at your carotid artery, okay? And I'm looking to see if there's any distension or pulsations. So normally I wouldn't be able to see anything or very little, okay? I'm going to do the other side, all right? And so what I'm going to do is I'm going to do this at different elevations of the bed, okay? So I've got you at 30 degrees right now. I'm going to lift you up to 45 degrees, okay?
Mm-hmm.
Okay, we got you at 45 degrees. And turn them slightly left. Okay. And so I would do that at, again, at 60 degrees and at 90 degrees. And normal findings would be no distension in the neck veins, and especially greater than 45 degrees. Okay. So now what I'm going to do is I'm going to listen to I'm going to put your back down a little bit, okay?
Mm-hmm.
And I'm going to listen to blood flow through those veins and arteries, okay? All right. And get you to hold your breath for just a minute, okay? All right. And what I'm listening for is I'm listening for just smooth blood flow, no turbulence, no swishing or thrills or anything like that, all right? Okay, sounds good. Alright, good. Alright, so now I'm just going to check with my hands, okay? I've washed my hands, I put on some clean gloves for you. Okay. So now I'm just checking the strength of the pulse, okay? You don't want it to be bounding, don't want it to be too weak. And I also want it to be consistent from beat to beat and also from side to side. Good. Alright. So now I'm going to move on to your chest area, okay? And I'm going to take a look at your heart. So first thing I'm going to do is I'm just going to inspect your chest, okay? And I'm going to look to see if, I'm just going to look to see where your heart, at the apex of your heart, where it lifts, okay? And normally I shouldn't see anything, or it should be a very small lift. Okay, Ms. Smith, doctor had a call, so we had to take a minute, but we're back. And so what I'm going to do now is I'm going to inspect your chest, okay? So we're going to have you open up your robe, okay? And so what I'm doing is I'm just looking at your chest at the apex of your chest to see if there's any movement there with the heart. And normally I wouldn't see anything, so I don't expect to see anything, but an abnormal finding would be like a bounding, or they call it a lift or heave, okay? So just looking at it, looks good. Okay, so what I'm going to do now is I'm going to put my hand down here in the mitral area, okay? And that's in the 4th to 5th intercostal space, mid-clavicular line, okay? And I'm basically feeling that same area, and I'm feeling for, you know, unusual, abnormal bounding beats of the heart, okay? And I want to check the size. The area that I'm palpating should be about the size of a nickel, and it shouldn't be displaced either one side or the other under normal circumstances. Okay? All right, good. All right, so now what I'm going to do is I'm going to take a listen, okay? And as I'm listening to your chest, I'm going to listen in several areas, but I'm going to start at that same area right there, and I'm first going to listen for the just the rate and rhythm of your heart, okay? So put it right here. So the normal rate would be between 60 and 100 beats per minute, and I'm going to listen for a full minute, okay? And if it's less than 60, that would be bradycardic. Greater than 100 would be tachycardic, okay? And those would be abnormal findings, okay? And I'm also listening to make sure that you have a regular pulse or heartbeat. And in the case of a regular heartbeat, then I would actually palpate your radial artery right here and look for a differential between what's here and what I feel, okay? All right. Okay, very good. All right, so now what I'm going to do is I'm going to listen to all the other areas of your heart, and I'm going to listen for various sounds, okay? And the normal sounds would be in S1 and S2, and those are the opening and closing of the major valves in the heart, okay? And as I go through different areas, I'm going to be listening for those. Abnormal findings would be accentuated or diminished sounds, or you might have split S1 or split S2, okay? All right, so I'm going to start with the aortic area, okay? And I'm going to use both the diaphragm and the bell. And as I'm listening, I'm also listening for other sounds. There's third and fourth heart sounds as well. And I could listen also for a murmur or clicks, okay? So I'm going to each one. It's the pulmonic area. Okay. All right, so we're going to do Erb's point. Okay. On both sides. All right, so this is the tricuspid area. All right. Doing that. All right. Finally, the apex, which is the mitral area. Okay, good. All right, and so some sounds are not audible in the position that you're in, so what I'm going to do is ask you just to lay on your left side for just a second. I'm going to listen for a second, okay?
Mm-hmm.
All right, if you can help me find... Okay, there we go. All right. All right, that's great. Okay, and the last thing I want to ask you to do is just sit on this edge of the bed and lean forward, okay? Listen. Oops. Okay, and we're done. Do you have any questions?
No.
Thank you for your cooperation.